Welcome back. If you haven't watched part 1 yet, I highly recommend starting there. We talked about what SIBO is, and more importantly, what actually causes it. Spoiler, it's not just bad luck or too many tacos, but now let's talk about how to recognize SIBO, how it's sometimes poorly diagnosed, and what you can really do to fix it. What are the symptoms of SIBO? Here's the fun part. SIBO symptoms look a lot like every other gut issue I've seen over the past 45 years in clinical practice. Why? Because SIBO is often a downstream result of a bigger problem, a disrupted microbiome. And when that ecosystem goes haywire, the symptoms can show up anywhere, especially in your digestive system. Common symptoms include bloating, gas, and flatulence. The bacteria in the small intestine start fermenting your food before it's properly digested. That trapped gas? Yeah, your pants know all about it. Abdominal pain. That gas stretches the intestines and causes inflammation. Not a great combo. Constipation or diarrhea, sometimes alternating because your gut just can't make up its mind. Indigestion and nausea. Meals may feel like they just sit there, because, well, they kind of do. Malabsorption and fatigue. Inflammation prevents nutrient absorption, which means your cells don't get the fuel they need. Result? You feel tired, foggy, and maybe a little moody. Weight loss. This happens both from malabsorption and the fact that eating starts to feel like a gamble. You never know how your body's going to respond. Bottom line, SIBO symptoms are common, frustrating, and confusing. That's why proper diagnosis is so important, but not that easy. How is SIBO diagnosed? The diagnostic puzzle. Let's break down the 2 most common tests and why they're less than perfect. 1. The breath test. This is the most widely used option. You drink a sugary solution, then blow into a tube multiple times over a few hours to measure hydrogen and methane gas levels. The logic? If there's bacterial overgrowth in the small intestine, those bacteria will ferment the sugar and release gas early, way before the sugar would reach the large intestine. The problem? Everyone digests at different speeds, so the test timing is unreliable. The test isn't standardized between clinics. And worst of all, false positives are common, leading to overprescription of, you guessed it, antibiotics. 2. Endoscopic aspiration and culture. This test is more accurate and more invasive. It involves anesthesia and sending a scope deep into the small intestine to collect a fluid sample for lab culture. Issues with this method? It's expensive, uncomfortable, and not widely done. And once again, treatment often ends in, you know what's coming, antibiotics. So, we're back at square one, which brings us to the real question. How do you actually fix SIBO? Here's the part most people skip, but it's the most important. Like most chronic conditions, SIBO is caused by a combination of several factors. It is not a single issue and requires a complete approach to resolve it. Fixing SIBO requires more than just suppressing symptoms. You've got to rebalance the gut from the ground up. That's why I created the ReGut solution protocol, which walks you through the step-by-step recovery process. But here's a preview of what that looks like. First target, your diet. Avoid raw vegetables and grains like wheat and oats. They're hard to digest and feed the bacteria. Cut nuts, seeds, and seed oils, which contain inflammatory fats that irritate your gut. Eliminate refined and artificial sugars, which fuel the overgrowth. Be cautious with beans and lentils. Fiber is good eventually, but not until balance is restored. Identify and eliminate food sensitivities. Food sensitivities trigger inflammation and worsen gut permeability. Use online labs or follow the steps in my book, The Gut Connection, to screen and correct these offending foods. Use targeted natural supplements. The ReGut solution protocol outlines the specific supplements I use in clinical practice every day to resolve gut issues. Here is a summary of the key components. Soothe and repair the gut lining. Think bone broth, L-glutamine, and gut-calming nutrients. Reinforce healthy gut bacteria. A broad-spectrum probiotic can help and is an essential part to balance the terrain as it is being cleared. Support the liver. It helps process toxins and plays a key role in digestion. If it's overwhelmed, so is your gut. Gently reduce bacterial and yeast overgrowth. Herbal antimicrobials like neem and noni can work without wiping out your good microbes. Last, manage stress and cortisol. Adaptogens like ashwagandha and calming nutrients like L-theanine help rebalance your nervous system, which supports your gut's immune function. So yes, SIBO is complicated, but it's not unfixable. You don't need to stay stuck in the antibiotic loop or feel like you're battling your belly every day. You just need the right roadmap, and that's exactly what the ReGut solution is designed to provide. You can find all the details on our website. I'll link it in the description below. If this video helped connect the dots for you, please give it a like, drop a comment, and make sure to subscribe so we can keep sharing real solutions to real gut problems. Remember, your gut isn't trying to ruin your life, it's just trying to get your attention. Together, we can help you discover your gut connection. Thanks for watching, and I'll see you in the next video.